Welcome to the deep dive. Today, we're plunging into, well, a really fascinating area of bioscience. It might just change how you think about healing and healthy longevity. We've got a stack of pretty cutting-edge research and clinical findings here, looking at two remarkable compounds, palmitoylethanolamide, let's call it PEA, and methylene blue, or MB.
Yeah, and our main mission today is to really tackle a specific statement we've seen, this idea that methylene blue has no effect on PEA's duration. We're going to show you why that's just plain inaccurate. We'll break down exactly how methylene blue, profoundly impacts PEA's activity in the body.
Right, that's a crucial starting point. And get this, it seems like a lot of researchers are so convinced that PEA is like a conductor for so many essential biological systems that a big chunk of their effort now is just finding ways to keep PEA around longer. Longer than its natural, very fleeting 10-minute lifespan. So after we nail that down, we're going to compile a pretty comprehensive list of health benefits linked to both PEA and MB.
And we'll go a step further, actually. We'll specifically look at conditions that seem to improve when these compounds, or sometimes just PEA, are combined with other things like lipoic acid or luteolin. Get ready for some real aha moments, I think, because the insights here are genuinely surprising. They really reveal the potential hiding in our body's own healing mechanisms.
Okay, so let's unpack this core interaction right away. The sources really hammer home why saying methylene blue doesn't affect PEA's duration is just, well, wrong. Can you walk us through the science on that?
Absolutely. So the first key point here is methylene blue's known role as a monoamine oxidase inhibitor, an MAOI. It's pretty standard textbook stuff in pharmacology that it's a potent, reversible MAOA inhibitor. And that's really critical for understanding how it interacts with other things in the body.
And TEA on its own, you mentioned it's fleeting. It has an incredibly short lifespan, right?
That's exactly right. Phenylethylamine, or PEA, has got an estimated half-life of only about maybe 5 to 10 minutes. And this super rapid breakdown happens because PEA gets chewed up very, very quickly by another enzyme, MAOB. So the body makes it, it does its job fast, and then poof, it's gone.
Okay, so this is where it gets really interesting then. Methylene blue has this profound impact, as the sources say, on PEA's duration precisely because it stops that quick destruction. How exactly does it do that?
Well, by inhibiting that specific enzyme, MAOB, the one responsible for breaking PEA down, methylene blue basically acts like a protective shield. It just allows PEA to stick around, stay active for a much longer period, giving it more time to exert its effects, throughout the body.
I'm trying to visualize that. So, okay, if PEA were like a really fast-burning candle, one that normally just snuffs itself out in minutes.
Yeah, that's a good analogy.
Yeah.
The methylene blue acts kind of like a special, slow-burning wick for that PEA candle. This wick lets the PEA candle burn for hours, extending its presence and its effectiveness, even though the PEA molecule itself hasn't changed.
That helps a lot. And the duration of this protective effect, it's tied to how long methylene blue itself hangs around in the body.
Exactly. Methylene blue's own elimination half-life is generally thought to be between, say, 5 to 6 hours, though some studies suggest it could even be longer, maybe up to 24 hours. So you'd expect its protective effect on PEA to last for several hours, and then it would gradually wear off as the methylene blue gets cleared by the body over maybe a 12 to 24-hour period. It's important to remember this is a temporary thing, right? It depends on the methylene blue being there. It's not a permanent change in how your body handles PEA, but it's a fascinating synergy, really.
Okay, so understanding that remarkable synergy with methylene blue really makes you wonder, what exactly is PEA itself, and what else can this natural compound do?
Right. Well, PEA is actually something our own bodies make. It's what's called an endogenous fatty acid amide. It's synthesized naturally when our body experiences stress, like injury or inflammation. You can also find tiny amounts in foods, things like egg yolks, peanuts. It functions as an autocoid local injury antagonist, or alleamide. That's a concept from Nobel laureate Rita Levi-Montalcini. Basically, think of it as your body's own little localized first responder. It's made right where it's needed to counteract problems and restore balance, homeostasis.
So it's kind of like our body's built-in system for bringing things back to normal locally?
Precisely.
Yeah.
And it does a lot. It shows a really wide array of biological functions. Most notably, it has quite powerful anti-inflammatory, analgesic, that means pain-relieving, and neuroprotective properties. Its main mechanism seems to involve activating something called PPAR-alpha, which then helps dial down pro-inflammatory proteins. It also has this interesting entourage effect with the endocannabinoid system. Essentially, it stops an enzyme, FAAH, from breaking down anandamide, which is one of our natural bliss molecules. so anandamide's calming effects last longer.
And our sources kept pointing out that its effectiveness has gotten a big boost from modern formulations. How's that work?
Yeah, that's a really key point.
Hmm.
Techniques like micronization and ultramicronization, which just means making the particles much, much smaller, have significantly improved PEA's bioavailability and absorption. Basically, it means more of it can actually get into your system and reach the tissues where it needs to work. It makes a pretty big difference in, how well it performs.
Okay, let's shift focus a bit to methylene blue then. Beyond helping PEA last longer, the sources talk about its own therapeutic potential. What stands out there, especially these hints about direct anti-cancer effects?
It is quite remarkable, isn't it? I mean, most people know it as a blue dye, but it's being seriously investigated as a direct therapeutic agent, especially in oncology. One key mechanism is how it acts as a metabolic disruptor. It can actually force cancer cells to switch their energy production. They
Hmm.
often prefer this less efficient method called the Warburg effect. MB can push them back towards oxidative phosphorylation, which is, the body's normal, more efficient way of using oxygen. This metabolic stress can basically deplete their energy, slow their growth, and sometimes even trigger cell death. We've seen this in preclinical models for things like glioblastoma and ovarian cancer.
So it's kind of like throwing a wrench in their energy production, starving them out, maybe?
In a way, yeah, it messes with their energy factories. And beyond that, it also seems to help with the area around the tumor. It can help reoxygenate tumors that are hypoxic, low in oxygen, which can make them more vulnerable to standard treatments like radiation. There's also some potential for it stimulating an anti-tumor immune response. And then MB can also directly trigger programmed cell death, apoptosis, by messing with the mitochondria inside cancer cells, and it can slow down their uncontrolled growth.
That's a lot of promising lab data for MB in cancer.
Yeah.
Do the sources mention any challenges in getting that into human trials or maybe known side effects people should be aware of?
That's a really important question. And yes, while the preclinical stuff is compelling, translating that into widespread clinical use as a direct cancer therapy is, well, still pretty early days. Like any active compound, MB does have known side effects. Things like skin discoloration are common, and because it's an MAOI, it can interact with certain medications, especially serotonergic ones. This really highlights why you need thorough clinical trials to firmly establish both safety and effectiveness in people before you'd see it used broadly like that.
Okay, so that's the investigational side, but where is methylene blue actually being used in clinics right now?
Right. Clinically, MB is definitely well established, but mostly as a diagnostic and surgical tool. It's used in sentinel lymph node biopsies, that's for breast cancer and melanoma staging, helping find the right lymph nodes. It's also used in chromonodoscopy. That's where it helps doctors visualize precancerous lesions in conditions like Barrett's esophagus or gastric intestinal metaplasia so they can biopsy the right spots. And the liver cancer surgery, it's actually used as an innovative dye to help guide the surgeons during resections.
And outside of cancer diagnosis, are there other established therapeutic uses?
Absolutely. It's found quite a bit of success in supportive care, most notably, perhaps, as an oral rinse. It helps manage the severe pain from oral mucositis, which is a really nasty side effect of chemo and radiation, especially for head and neck cancers. It's also a proven antidote for something called ifosfamide-induced encephalopathy. That's a type of neurotoxicity some cancer patients can experience from a specific chemotherapy drug.
And surprisingly, the sources also brought up its effect on candida infections.
Yes, that's another interesting area. Methylene blue shows clear antifungal activity against Candida species. It seems particularly effective when used with photodynamic therapy, or PDT. It disrupts the mitochondria in the fungal cells and can also stop them from switching into their more invasive, high-full form that's crucial for Candida causing problems and forming those stubborn biofilms. In fact, PDT using MAB has been shown to actually inhibit and even destroy Candida biofilms. It can even make conventional antifungal drugs work better, leading to, in some cases, no detectable Candida for up to 30 days. So it's an intriguing angle for tackling persistent fungal issues.
Okay, now for the part many listeners are probably waiting for. What specific conditions and ailments have actually shown improvement with PEA, MB, or maybe combinations? Let's start with PEA and its impact on, say, neurodegenerative issues and cognitive health, given those neuroprotective properties you mentioned.
Okay. For amyotrophic lateral sclerosis, ALS, which is just such a devastating disease, PEA has shown some genuinely encouraging results in early studies. Clinical observations suggest an improved overall clinical picture. Also, better lung function, specifically slower decline in forced vital capacity, which is a key measure, and reduced desensitization of certain muscle receptors. There are even case reports suggesting things like improved muscle force, better respiratory function, and maybe delaying the need for things like tracheotomy or even delaying death. For ALS, any potential positive signal like this is, well, profoundly significant, even if it's early days.
That really does sound significant for ALS. What about other neurodegenerative conditions, especially thinking about those special formulations, maybe combined with other things?
Right. For frontotemporal dementia, FTD, there was a phase 2 randomized trial using co-ultramicronized PEA combined with luteolin, and it showed significantly less decline in the overall disease severity and functional abilities compared to the placebo group. That's quite promising. And for Parkinson's disease PD, some observational studies using ultramicronized PEA, just PEA on its own, but in that special form, suggested a really remarkable reversal of the measured disease severity scores. Along with that hang significant improvements in motor symptoms, non-motor symptoms, and activities of daily living. These findings really point towards PEA influencing complex neurological pathways in PD.
Wow. The Parkinson's results sound almost too good to be true from observational studies. What about cognitive issues more generally, like memory problems?
Well, for Alzheimer's disease, AD, the preclinical studies, mostly in animal models so far, are very strong. They show PEA can potentially reverse or prevent memory deficits, reduce neuroinflammation, and counteract oxidative stress. That fits with its role as a local first responder, right? And PEA combined with luteolin was also noted to improve cognitive performance in a patient diagnosed with mild cognitive impairment, MCI. Then there's post-stroke recovery. Here, PEA combined with luteolin led to measurable cognitive gains. The sources mentioned an average 2.5-point increase on the MMSE scale, which is a standard cognitive test. Plus, improvements in neurological status, spasticity, and pain. It really suggests a role in neural repair and recovery processes.
It certainly seems like PEA has a pretty widespread impact across the nervous system. What about actual physical injuries, like to the brain or spinal cord?
It seems so. For spinal cord injury, SCI, PEA, especially when it was combined with luteolin in mouse models, led to reduced inflammation, less tissue damage, and significantly better motor function recovery. And that same combination, PEA plus luteolin, also significantly reduced swelling, or edema, and the area of brain damage in traumatic brain injury, TBI models.
Okay.
So yes, it points to a broad neuroprotective and recovery-boosting potential.
And of course, pain. We hear a lot about PEA being used for different kinds of pain. What did the sources confirm there?
Yeah, the sources are very consistent on this. PEA is a well-researched analgesic. It's shown significant effectiveness in reducing various types of chronic and neuropathic pain. Think conditions like fibromyalgia, migraines, sciatica, carpal tunnel syndrome, general musculoskeletal disorders. It can be used on its own, or sometimes it's combined with alpha-lipoic acid for potentially better pain reduction. For migraines specifically, PEA, sometimes with melatonin or luteolin added, has been shown to reduce the number of headache days and the need for pain medication. It can even reverse something called allodynia. That's when normally non-painful touch feels painful, which can happen with chemotherapy-induced peripheral neuropathy. And it seems to work synergistically, meaning better together, when combined with the drug gabapentin. Its anti-inflammatory action appears really central to its pain-relieving effects.
Moving beyond the nervous system for a moment, did the sources mention studies on sensory systems, like vision or the respiratory system?
Yes, they did. For glaucoma, ultramicronized PEA has been shown in studies to help reduce intraocular pressure, the pressure inside the eye, and also improve visual field measures. Plus, it seems to have neuroprotective effects on the retinal ganglion cells, which are crucial for vision, and perhaps very relevant recently for post-COVID-19 olfactory dysfunction. The loss of smell, the combination of ultramicronized PEA and luteolin, especially when paired with olfactory training, showed significant improvements. People got better at identifying odors, had less parosmia that's distorted smell, and some even reported less brain fog and better memory.
What about respiratory inflammation itself, like with COVID or even just common colds?
For general respiratory inflammation, preclinical work using PEA combined with alpha-lipoic acid showed a significant drop in reactive oxygen species and inflammatory cytokines in lung cells. This suggests it might help counteract those dangerous cytokine storms. And interestingly, there were actually clinical trials way back in the 1970s that reported positive outcomes for PEA in treating influenza and the common cold. So there's a historical basis for its potential immune modulating role there too.
Were there other broader applications for PEA mentioned? Maybe things like cancer or bone health?
Yes, definitely. Beyond those specific conditions, PEA also showed promise in preclinical models of colorectal cancer, where it seemed to reduce precancerous lesions and slow tumor cell growth. For breast cancer models, it was linked to inhibiting proliferation and boosting signals for programmed cell death, apoptosis. It also seems to aid in bone and connective tissue repair, including helping fractures heal and supporting muscle recovery, possibly by supporting collagen production and helping resolve inflammation faster.
And does it extend into areas like mental health or other inflammatory conditions?
It appears so, at least based on early research. In preclinical models, PEA showed an antidepressant-like effect in scenarios mimicking depression. When combined with luteolin, there was a case study suggesting improvements in behavior, cognition, and sociability for someone with autism. For endometriosis, PEA combined with something called polydatin was linked to reduced chronic pelvic pain and better quality of life in women suffering from it. And for vascular injury, that same PEA polydatin combo showed reduced inflammation and oxidative stress in preclinical models. So yes, it really does seem like a remarkably versatile compound.
Okay, and then circling back to methylene blue specifically, beyond the diagnostic uses, what are its direct therapeutic applications, either clinically used now or looking promising in preclinical work?
Right. As a direct therapeutic, its main potential in cancer is still largely preclinical. The focus is on specific types like glioblastoma, ovarian cancer, and also pancreatic and bladder cancer, often using it with photodynamic therapy, leveraging that metabolic disruption we talked about. In lab studies, it's shown toxicity against certain leukemia cells, like erythroleukemic cells, K562 and NLM6 leukemia cells, and also against prostate cancer cells. Clinically, as we mentioned, its established successes are really that topical oral rinse for oral mucositis pain management and as the antidote for ifosfamide-induced encephalopathy. And then there's the candida infections angle, where it shows strong antifungal activity, stops the switch to the more dangerous hyphal form, and can break down biofilms, especially when activated by light and PDT.
Okay, wow, that's a lot to take in.
It really is. This deep dive, I think, truly highlights how far the research has come in understanding the really complex roles of compounds like PEA and methylene blue. From PEA acting as our body's own subtle, localized injury antagonist, gently nudging systems back towards balance, to methylene blue's quite surprising metabolic influence on cells, plus its vital diagnostic and supportive care roles. The interconnectedness of our biology is just, well, astounding.
Absolutely. And the sheer breadth of conditions showing some level of improvement. I mean, from the profound implications in neurodegenerative diseases like ALS and Parkinson's, to real gains in chronic pain, sensory issues, even inflammatory responses, it's just a powerful testament to the ongoing scientific exploration. Now, of course, we need to remember a lot of this research is still in earlier stages, right?
Yeah.
Especially for methylene blue as a direct therapeutic, and some PEA applications definitely need those larger randomized trials. But still, the preliminary findings are incredibly encouraging, wouldn't you say?
I would, and it really raises an important question for you, the listener, to think about. How might these evolving insights into our body's own natural healing compounds, these metabolic pathways, how might this reshape our approach to chronic conditions down the road? And maybe what role might you play in just staying informed about these really dynamic, evolving frontiers of science?